Thank you for joining today's webinar on farm worker health and hygiene. This webinar is brought to you by Cultivating Success. Cultivating Success is a program that's a partnership of University of Idaho Extension, the nonprofit Small Acreage Farming Organization Rural Roots, and WSU Food Systems Program. Today's presenter is Stephanie Smith. Stephanie is a consumer food safety specialist with Washington State University and is located in Pullman. I'm Colette D. Phelps. I'll be your moderator today. I'm with University of Idaho Extension in the Northern District and located on the Moscow campus. Before we start today's presentation, I just want to go over a few webinar tips. It could be helpful to you to close all the other programs that are running on your computer so that you can dedicate all of your bandwidth, especially your internet power, to this webinar. If you are having problems with your sound, clarity, speed, etc., you can switch to your phone, and that call-in number is provided in your welcome email. If you do switch to the phone, just remember to mute your computer so that you don't get feedback. At any time during the webinar, you can type questions in for the speakers or questions regarding help with sound or speed into the question box that you will find in the control bar. It's generally located at the bottom of your screen. So please go ahead and type questions in. If there's questions that are, timely, and I can step in and ask Stephanie to answer those, or I can hold them to the end of the webinar when we have a general Q&A session. I sent you the handouts for today's webinar via email, so you don't have to make any notes about the actual content of the slides, but perhaps about the conversation, you would like to add that to your handout. So with that, I want to go ahead and hand the webinar over to Stephanie. So I'm going to stop sharing my screen, and Stephanie's going to be able to share hers. So Stephanie, go ahead and take over.
Great. Can you guys hear me okay?
I can hear you, yes.
Perfect. Well, thank you.
We just need to have your slideshow go into presentation mode.
Thank you. Great.
Sure.
Well, thank you all for joining us today for this webinar. We're going to be talking about farm worker health and hygiene and the importance of health and hygiene for keeping produce safe. I'll just give a little bit of background on why this is so important, and then we'll talk a little bit about the different types of organisms that can contaminate produce and how produce becomes contaminated. We'll talk about the role that workers can play in inadvertently contaminating produce, and then discuss steps to reduce contamination. We'll also talk about worker training and the fundamentals of a decent or an effective training program, and then summarize our presentation today. So with that, I'll get started. So produce safety, of course, begins on the farm. Contamination of produce can occur at any step, but it's essential to make sure that there are programs in place to prevent produce from becoming contaminated during the growing, packing, harvesting, and holding of fresh produce. Unlike other food products, fresh produce does not have a kill step to eliminate pathogens. So for example, it doesn't undergo a heating step or other steps that can reduce or eliminate pathogens on produce. So because of that, once pathogens become contaminated, it's really hard to get them off of the produce. Even with proper washing, it can be difficult. So there's a lot of foodborne illness outbreaks that have occurred from fresh produce, from contaminated fresh produce. In the US from 1996 to 2010, 23% of all outbreaks were caused by produce. And from 2006 to 2014, 16 of the 68 multi-state foodborne illness outbreaks were associated with just vegetables alone. Although there's a lot of different microorganisms that can cause foodborne illness outbreaks and contaminate produce, bacteria do cause the most outbreaks, illnesses, and deaths across the U.S. And a lot of people think with foodborne illness that it's just, you know, a 24-hour stomach flu and that it's self-resolving. And in many cases, that's true. But foodborne illness can be much more than that. It can result in lifelong illness, gastrointestinal problems for the rest of somebody's life. It can cause reactive arthritis and even a lot of organ damage and organ failure. And then, of course, it can cause death. So the goal is to prevent produce from becoming contaminated in the first place. And the focus of this webinar will be on utilizing your workers to help you from preventing produce from becoming contaminated. I'm going to talk a little bit, give you a little bit of background on microbiology and some of the things that are of concern with fresh produce. So essentially, microbes can be passed from people onto food. And of course, there's other ways that microbes can be passed on to food. But given that we're talking about worker health and hygiene, we're going to focus on how people can pass pathogens on the food. And this can include bacteria, parasites, viruses, and fungi. We're going to mostly focus on bacteria, parasites, and viruses during this webinar, since those are the ones that can most commonly contaminate produce from workers. A little bit of background on viruses. They do need living cells to reproduce or to grow in number, and they don't reproduce in food, but a lot of viruses can survive on surfaces for a very long period of time. So if somebody is infected with a virus and they're handling fresh produce, they can transfer that virus onto the food, and even though the virus won't grow, it can still there can still be enough of the virus particles on the food so that when somebody consumes it, that they end up getting sick as well. And a lot of these viruses will survive both freezing and cooking, and they usually contaminate food through poor personal hygiene or people handling food when ill. Two common representatives that we see associated with that can be associated with fresh produce are norovirus and hepatitis A. And I'll talk about each of these a little bit. So norovirus, some of you might have been familiar with, might be familiar with this. You hear about outbreaks of this on cruise ships quite a bit. First of all, it is transmitted through the fecal oral route. So basically someone uses the toilet, they don't wash their hands properly, and then they handle something and you know, a doorknob for instance, and then somebody else comes along, touches the doorknob, and then maybe goes and eats food, and now they're infected with norovirus. It can also occur from person-to-person contact and from contamination of food and water. And then, of course, produce can become contaminated directly through contaminated water, such as wastewater that runs off into irrigation canals, rivers, and other bodies of water. The infectious dose is very low, so less than 100 viral particles can make somebody sick. And this virus is shed by both people that are showing signs of illness and ones that may not be showing any signs of illness. So that's very concerning, because somebody that may appear perfectly healthy could still be shedding the virus and contaminating produce. Generally, for norovirus, there's a 1 to 3 day incubation period, and it results in a really horrible bout of nausea and diarrhea. And the symptoms usually last about 1 to 3 days. Dehydration is the most common complication, but usually the illness is self-resolving, so it'll go away on its own. But after symptoms diminish, a person can still shed the viral particles for 2 to 8 weeks afterwards. And people with immunocompromised systems can shed the virus for several months to 2 years. they can still be carrying the virus with them even though they're not showing symptoms. Hepatitis A is another one that we see commonly associated with fresh produce. This virus is transmitted through person-to-person contact and also through the fecal-oral route, through consumption of contaminated food or water, or consumption of food grown with contaminated water. So this virus attacks the liver. It can cause jaundice, so the yellowing of the skin and eyes due to its attack on the liver. It can cause nausea, stomach pain, fatigue, and a low appetite. It usually resolves within 2 months, but it can potentially last longer in some individuals and cause more severe illness as well. So we're going to move on now to talking about parasites. Again, parasites are like viruses in that they do not grow in food, but they can survive on the surface of food. And they can be passed from human or animal feces or contaminated water onto food. And I've given a list of some different examples of parasites, such as Cryptosporidium and Cyclospora, and Giardia. A lot of these are from contaminated water or water that's been contaminated with sewage. So an example of a parasite is Giardia. And this organism survives outside the body for long periods of time, so it can survive for as long as weeks to months, which is a really big problem if it contaminates fresh produce. And on top of it, this organism is tolerant to chlorine disinfection. So even using chlorine in wash water won't necessarily kill this organism. So this organism lives in the intestines of people or sometimes animals, and is passed in the feces. And it can also be transmitted from person to person and is commonly seen in contaminated water. And so again, this causes a lot of stomach and abdominal cramping, upset stomach, and nausea and diarrhea. And symptoms can begin 1 to 3 weeks after infection and last as long as 2 to 6 weeks and sometimes even longer. Moving on to bacteria. Bacteria can survive and grow in the environment. So these types of organisms can actually grow on produce or grow inside of, for instance, a produce packing facility. And many of the organisms can also grow during refrigeration. One example I have up here is Listeria. Listeria grows really easily under refrigeration temperatures. And so that's really been a concern with fresh produce, and especially produce that's been cut as well. Some of you may remember that there was a big caramel apple outbreak due to contamination of the apples with Listeria. And again, even under refrigeration, this organism could grow. So this organism can be passed from human or animal feces onto produce. Workers that are ill with Listeria can potentially contaminate produce. And then, of course, using contaminated water for irrigating the crops or for wash water after harvest. So the consumption of the contaminated food and water results in infection. So some different examples, aside from Listeria, that fall under the bacteria category include E. coli. Many of you have probably heard of O157H7, Shigella, and then Salmonella is another organism that's commonly associated with fresh produce. And I'll talk about each of these in a little more detail. So pathogenic E. coli, it's usually from animal sources, but humans can become infected and potentially pass the organism onto the produce or infect other people. And it's also found in many different foods. So we see it a lot in fresh produce, unpasteurized ciders, and I'll even go ahead and add that there's been a problem with it in wheat products, especially raw flour. So symptoms of E. coli are bloody, severe bloody diarrhea, vomiting. You can end up with hemolytic uremic syndrome, which is basically where you end up, your kidneys end up shutting down, and this can be very deadly. So E. coli can cause very severe, a very severe illness. And in a lot of cases, as many or as few as 10 E. coli organisms can cause these severe symptoms and even death. The onset of illness is usually 3 to 4 days after consumption of the contaminated food or water, and illness can last 2 to 9 days. Another organism that we commonly see pass from humans onto fresh produce is Salmonella Typhi. So this organism is carried in people's bloodstream and in their intestines and feces. It's passed from an infected person onto the produce, and we see this a lot in poor agricultural practices are being employed and poor worker hygiene. We see this a lot with ready-to-eat foods, so foods, of course, that would not be undergoing a kill step, such as fresh produce or even things like sandwiches, for example. The symptoms include nausea, vomiting, diarrhea, fever, and headache. And even though a person may not show signs of illness or the illness has ended, they may still be shedding this bacteria in their feces for weeks after the symptoms have ended. So this particular organism, Salmonella Typhi, only lives in humans, but it can survive on produce. We're going to now talk more directly about contamination by workers and how we can prevent contamination by workers. So contamination can occur with ill workers that are handling produce, especially if they're showing signs of diarrhea or vomiting. They should not be handling raw produce or any produce. Workers can contaminate produce from walking between, for instance, manure, compost areas or farm animal areas into the growing areas by tracking in feces on the bottom of their boots. Workers eating, drinking, or smoking in growing areas can contaminate produce because they're having that hand-to-mouth to plant contact. And so that's a way to spread different types of microorganisms onto produce. And then, of course, workers not washing their hands adequately after eating, drinking, smoking, or using the toilet is another major way that produce can become contaminated. Workers can also contaminate tools and equipment. So, for example, if a worker is sick and they're handling tools and equipment, that can then contaminate the produce. Or if they're using tools and equipment in an area where there might be, for instance, manure or contaminated water, and then they're using those tools in the field, that can also contaminate produce. Not changing gloves, boots, or clothing regularly is also a hazard. We always tell people that they should dedicate boots or gloves to specific activities, especially if it's a multi-use farm where there's animals in one area and then produce being grown in another. And we'll talk more about some of these steps in greater detail in a moment. And then, of course, feces can contaminate produce directly if workers are defecating in the field. The new produce safety rule that's part of the Food Safety Modernization Act requires that farms have to have well-stocked and clean facilities close to working areas for growers to use. And then, of course, produce can also become contaminated if a worker becomes injured and or has an injury that might be infected, for example, and then is handling produce. So next we're going to talk about taking some steps to reduce contamination from occurring in the first place. So we always want the workers to maintain personal cleanliness. And so this means ensuring that they're wearing clean clothing, that if gloves are being used, that the gloves are clean, and also that they're using footwear that's dedicated for use in the growing areas and that hasn't been used over, for instance, by manure piles or in animal areas. The clothing, gloves, and footwear should be maintained in good condition. And if they do become contaminated, they need to be changed out. Also, workers should remove or cover jewelry because, first of all, it can cause a hazard if it falls into the produce and ends up if it ends up in the produce, it could become a physical hazard for the produce. And then also it makes it difficult to employ proper hand washing procedures, for example, if rings are being used. Workers should not be eating, smoking, or drinking during work activities, and the farm should provide a dedicated area for workers to engage in these activities. They don't necessarily need to be in a separate building, but even just putting a dedicated area at the end of a row for workers to be able to go drink or to take lunch breaks would be suitable and a good idea to employ. You most definitely want to exclude ill workers. So some of the signs that you might look for that might indicate that a worker is ill can be things such as showing jaundice, so the yellowing of the skin and eyes, taking excessive trips to the restroom, and then of course the more noticeable ones if they're having vomiting, a lot of diarrheal issues, and nausea. Any workers that are showing these symptoms should be assigned to another duty that does not involve either handling of the crops or any cleaning and sanitation procedures. And workers must know to notify their supervisor if ill. A lot of times this can be really difficult because workers don't want to lose pay from being out sick. And so a lot of times they'll hesitate to notify their supervisor. But it's a good idea if you can try to find other duties that they can do so that they are not coming in contamination or are not coming in contact with the crops, not coming in contact with tools, and not spreading illness around to other workers, but can still maybe contribute and not lose pay. I know in Washington that there's been some changes so that workers, certain workers can now accumulate sick leave, and that might be something that would be a good idea to employ on your farm to help reduce workers working when they're ill. So regular hand washing is of utmost importance, and even though a lot of people think that they are washing their hands properly, most of the time people are not. And I just want to go over some of these some of the details revolving around regular hand washing. So first of all, hands should be scrubbed with soap and water for 20 seconds and then rinsed well. The water regulations regarding hand washing water under the produce safety rule require that water must have no generic E. coli in it. So the water needs to be of adequate sanitary quality. The water that's going to be used for hand washing must be of adequate sanitary quality. Workers must wash their hands after using the toilet, starting or returning to work, eating, drinking, or smoking before putting on gloves, and after animal contact. And of course, if any time hands become contaminated, they need to go wash their hands properly. Farms must provide proper toileting facilities. Usually these are regulated under OSHA. So OSHA requires that you have to have one facility per 20 workers within a quarter mile of the work activity. But in addition to this, the toileting facilities need to be cleaned and stocked regularly, and they must have running water. As I mentioned, that water cannot have any generic E. coli in it. And given that, the water should be tested to ensure that it's safe and clean enough for hand washing activities. You must provide soap and then paper towels for workers to dry their hands after washing. And then there needs to be garbage cans to collect the paper towels. And then this must be available to workers and visitors.
Stephanie, we have a question, and this is regarding water tested for hand washing stations.
Yeah.
The question is, do you need to have your water tested for hand washing stations if you have a well?
So that's a really great question. I appreciate you asking that. So under the, it's going to depend on your farm size, whether by law you have to do it or not. If you are covered under the produce safety rule, which is outside of the scope of this webinar, although I have mentioned it a couple of times, then under that requirement, you have to do water testing, and you have to ensure that it's meeting the water quality requirements. It falls under the what they call post-harvest water. And if you're exempted from the produce safety rule because you're a small farm, then you don't have to do the water testing. But it's a good idea, especially if you're on a well in general, it's a good idea to have your water tested regularly, even if it's just once a year, to make sure that your water quality is good and that you're not having issues with any microbial contamination that could potentially affect your produce that you're growing.
Great. Thank you
You're
for
welcome.
answering that question.
Okay, and so some other steps to reduce contamination, I've already mentioned that you should dedicate footwear, gloves, and clothing. And I've also mentioned, you know, especially when you have a multi-use farm where you have animal activities and produce activities occurring on the same farm, that you should have dedicated footwear, gloves, and clothing for those activities, so that you're not causing cross-contamination from occurring, from being in the animal areas and coming in contact with their feces and then going out into the field and, you know, working with the growing or harvesting and packing of produce. Clothing, gloves, and contaminated footwear should be removed prior to taking breaks, and then also using the restroom. So a lot of times what we see is, you know, for instance, in the apple business, for example, sometimes workers will take their bags, their harvest bags, in with them into the restroom, and that's not appropriate for them to do that. It's a good way to contaminate produce, even if the bag's empty. So there should be an area for the workers to be able to hang up, you know, their or store their gloves, to potentially change out footwear and any other items that they're wearing that are associated with the harvest activities. Have a place for them to store that where they can be kept clean and not become contaminated. With regard to worker injuries, you want to discard any produce that may have become contaminated if a worker became injured. And you also want to make sure that workers are treating and covering their wounds, and that they're not having their wounds coming in contact with fresh produce. If any surfaces become contaminated from a worker injury, they need to be cleaned and sanitized. And workers need to know to report all injuries to their supervisors. You also want to make sure that you maintain first aid supplies and that they're well stocked. I don't know how many times, you know, I've gone some place and looked for a first aid kit and it's not been well stocked, or there's band-aids, even, you know, the simple band-aids are missing from the first aid kit. So it's important to make sure that those are checked regularly and kept stocked. We're gonna now move on to talking about training workers. This is really important that workers are trained and that it's done well. Workers can really be your first line of defense in keeping produce safe and notifying you if there's any problems on the farm. And so it's really essential to make sure that you have a good training program in place. So workers must be trained for their job that they're doing, and under the produce safety rule, on top of them being trained for the job that they're doing, they also must receive food safety training. So if you're covered under the produce safety rule, those two things must be done, especially receiving the food safety training. The training must be documented, and the workers must be familiar with different types of hazards and contamination sources. So workers should really know what steps need to be taken to reduce different types of hazards and reduce contamination. So for example, I have this picture of a deer in a field here, and you know, if workers are well trained, they can let you know if there's an area of the field where maybe there's been some deer activity, they've seen deer feces, maybe they've noticed some produce that's been stomped down due to animal activity. If they know to look for those things, they can let you know when there's a problem in the field so that you know not to harvest that produce, and you can take steps to keep contaminated produce from entering in into the packing operations. You also want to make sure that the training is reinforced and that they have a good understanding of the expectations and that people are following them. It doesn't do any good to deliver a training and then not have anybody actually adhere to what was taught or understand it. You want to repeat the training at least once per year, and even more often if farm policies or procedures are not followed, if there's been incidences or issues where corrective actions need to be put into place, or if you have new policies or procedures. And then again, you want to be doing monitoring to make sure that the policies and the practices on the farm are being followed. If they're not being followed, then you're probably going to have to go back to repeating the training again. And if that's not sufficient at correcting the problem, then you're probably going to have to do modifications to the training until the training is understood and the procedures and policies are being followed. Training delivery is essential, and there's a lot of different ways to deliver training. So first of all, you want to make sure that you're delivering the training in the worker's native language. It doesn't help to deliver training in English if all of your workers are Spanish speaking, for example. So you want to make sure that they can clearly understand what's being said and what you're training on. Oftentimes, it's going to be really important to use a combination of delivery systems so that they can receive the information in different ways. So some examples we have here are using slides and charts, having written materials, orally delivering the content to them, or even having pictures to emphasize the training or the issues that you're trying to get across to them during the training. You really want to make sure you're providing adequate time for the training. You don't want to rush through it. You want to have time to answer people's questions, to make sure that they're understanding why the training is being delivered and the important aspects of it. And then you also want to be aware that a lot of times there's different misconceptions and that these need to be addressed. So for example that's used when we give the official Produce Safety Alliance growers training is that in a lot of different countries, for example, their sewer systems cannot handle toilet paper, so those end up going on the floor or in the maybe in a garbage can. And so there's a misconception that, you know, in the United States, that's also where toilet paper, for instance, might go. And so when delivering a training, for instance, about toileting and proper hand washing, that might be a misconception that or a misunderstanding that you might need to address. And a lot of times these may not be necessarily clear, but if you spend the time to deliver the training and try to, you know, connect with the workers and understand some of the misunderstandings that they might have, then you can properly address those. So after you've delivered the training, the workers should be aware of the practices and procedures that are required and are in place on the farm, and they should actually be able to follow those practices and procedures correctly and perform their job correctly. It's really important that the workers can identify food safety issues or hazards and know when to report those to the supervisor. Workers must know what proper hand washing and toileting procedures are, and also be able to follow proper clothing, footwear, and glove procedures. Your workers are really your first line of defense from keeping contamination from occurring. And, you know, it's a lot of times it's a good idea to put in a reward system for workers when they do help, you know, show signs that they're helping you with this, when they do come and report illnesses or do report issues that could be a potential hazard or cause contamination. The workers should also be trained to ensure that equipment and facilities are in good condition and that things are working properly for both the safety of the worker and the safety of the produce. And then, of course, any other training that you've delivered, the workers should be well aware of those procedures and policies and be able to implement them. So in summary, workers really are your first defense to produce safety. So you want to make sure that they're trained well and that they can help you out with ensuring that the produce that you're delivering to consumers is safe. Workers can spread or cause contamination, so you want to make sure that you exclude ill workers from handling produce or from produce growing, harvesting, packing, or holding operations. You want to also exclude them from equipment or facilities that are involved in those operations if they're sick or if they're injured. You want to make sure that workers are keeping their clothing, their gloves, their footwear clean, that they're following proper hand washing and toileting protocols, and that the facilities are also being kept clean and well stocked. Again, proper training is really essential for prevention of contaminating produce and for preventing hazards on the farm. Your workers should know who to report issues to, and they should be able to identify those issues as well and actively take steps to remedy the situation. And workers absolutely must be trained not only for the job that they're doing, but they need to be trained in food safety as well. And they need to have an understanding of why those procedures and policies are in place and how they can affect food safety. And with that, I will turn it back over to you, Colette, and I can take any questions that people might have.
Great. Thank you, Stephanie. If you have any questions, you can go ahead and type them into the question box. We have one question to start, and that's a question about salmonella. We often hear about salmonella related to poultry, and in your slide, you talked about the kind of salmonella that you were referring to as being something that was, as I understood it, unique to humans. So could you talk a little bit about salmonella and if there's different kinds or why we might have that association with poultry?
Certainly. So there are different types of salmonella. The one I referred to in my slides is Salmonella Typhi, and that's associated with humans, and specifically caused from human contamination of food. There is other strains of Salmonella that do come from poultry. We also, just see it in birds in general. And then also even lizards can carry salmonella, which is something that a lot of people don't know. So there are different types. And again, the one I mentioned specifically in my slide was Salmonella typhi, which is the source is from humans.
Okay, thank you.
Yes.
Another question is, what is the difference between cleaning and sanitizing?
That's a great question. I'm glad you asked that. That might actually be something good to add to the slides. So there is a big difference between cleaning and sanitizing. We always tell people you cannot sanitize a dirty surface. So a lot of times with the different types of sanitizers that are being used, they are ineffective if the surface is dirty. So the organic materials will basically bind up the sanitizer, and then the sanitizer can't do its job to reduce the microbial load on surfaces or in, wash water, for example. And so cleaning steps need to be taken first before sanitizers used. So, for example, on surfaces, we always tell people you want to remove the visible dirt on the surface, and then you want to use some sort of detergent to scrub and clean the surface and then rinse it off well. And then after that, you'll use a type of sanitizer to actually reduce the microbial load and kill pathogens on the surface. So they're two completely different steps.
Great, thank you. And we have a couple questions about resources. So the first question is, do you have any samples of farm worker policy handbooks that would help with training a new employee?
That's a great question. Unfortunately, we do not have any. I don't have anything. I don't know about you, Colette, if University of Idaho has any samples available.
I will look into that a little bit, and we have a produce safety specialist that's located in Boise, and I bet that we can find something that we will post on the Cultivating Success website. So in a couple slides, I will show participants where they can find the resources associated with this webinar. So Susan, we'll go ahead and find some resources that we'll post on that site.
And I don't have any specifically available. There's some other extension agencies that do have resources available. And then I know that there's a lot of different businesses that have made resources that are, really focused on training. So on one of the slides, I showed a person, there was a picture of a person delivering training out in the field. I can't remember the name of the business right now, but I know that there was one business in particular that put together there were these really awesome flip charts for training, and you can set them up just on the tailgate of a pickup truck and deliver the training right there out in the field, and they were available in different languages. And, when I saw those, I thought that they're really excellent because the training was all put together and it was a delivery method that could be used right out there in the field.
Yeah, that That's really great. I do know that we have some training videos that are available through the University of Idaho Produce Safety website. So I will make sure that there's also a direct link to that website and our Idaho State Department of Agriculture website. So we will find some resources that are available and get those posted. And the final question that we have this morning is, do you have any resources that talk about what different kinds of sanitizers are available?
That's another great question. I can work with Colette again to get, as she had stated, to get some of those resources that are put up on the Cultivating Success website. So there's a lot of different sanitizers that can be used, whether chlorine or quats are pretty common. Those are the two that we usually see, but the important thing about sanitizers is that, first of all, they have to be food grade, and then you definitely do want to make sure that they're effective for your operation and for what you wish to use them for. But I can work with Colette to try to make some of those resources available as well.
Great. Thank you, Stephanie.
Thank you.
Okay, that's all the questions that we have today. So I'm just going to remind folks that this is the website, the portal, where you can access both the recorded webinars and future webinars. So by going to this Small Farm and Ranch webinar series. And this webinar series, we both have the recordings and upcoming webinars. So our upcoming webinars, tomorrow we have one on irrigation and water rights in Idaho. And then on the 24th, a webinar on consumer demand for local food and how to capture that. And then looking at February 25th, how do you look at Quicken versus QuickBooks and think about record keeping for your farm? So if you go to the cultivatingsuccess.org website, you will be able to find the recorded webinars. When you go to access the recorded webinars, you'll find those supporting materials that we are going to find and upload to our website. We really appreciate your feedback about our webinars. That's really important for us for improvement and deciding what we're going to focus on in the future. So if you would take a moment to click on this link, which is in the handout I emailed you, or is going to actually launch in your browser after the webinar is concluded, we would appreciate your taking about 3 minutes to complete our very short post-webinar evaluation. With that, thank you very much, Stephanie, for joining us today.
Thank you.
And we look forward to having you on a future webinar. And thanks to our participants. If you have any questions, you'll be able to reach me through the Cultivating Success website. Thank you very much and have a great day.
Thank you.